Okay,
we get
so
another call,
yeah,
Jess.
we're running out of time, but I'm gonna try to be as comprehensive and
Yeah, we're going to talk
stuff as I
about
can be
we're going
with
to
the
talk about
Medicare thing.
Medicare now.
Um,
Regarding Medicare, when do I need to sign up and how do I do it, Jess?
hang on, I'm stuck here. Okay. You need to sign up 3 months prior to turning 65 is when you can start signing up. You'll be signed up automatically if you're already taking Social Security before you turn 65. If you're still working when you turn 65 and you're going to keep your employer health plan, you still want to sign up. You're going to have to sign up yourself for Part A, and that's free. There's no premium for Part A. That's the hospital part of Medicare. But you'll delay your Part B, which is the like doctor medical coverage of Medicare that has a premium to it. You'll just delay that until you actually retire and aren't on your work's health insurance anymore. So you can sign up on socialsecurity.gov if you're pretty tech savvy, or you can sign up at the Social Security office. Locally, you can set an appointment there. That's also how you sign up for Social Security that we just talked about.
So Jesse is signing up for Medicare. Is that sufficient? Is that all a retiree needs to do for health care at retirement?
No. So there's two parts of Medicare. There's Part A, like I talked about, that covers if you get hospitalized. And there's Part B, and that covers like doctors' costs. And there's a bunch of gaps in both of those things that can leave you with high out-of-pocket costs that you would have to pay yourself. So there's deductibles that you have to pay. The hospital deductible is per time you get hospitalized, not per year. So you could have, if you get hospitalized multiple times in a year, you could have to pay that deductible more than once. There's different co-insurance and co-pays that you're responsible for, that if you had something big happen to you at some point while you're retired, you could owe a lot of money out of pocket if you don't have anything besides just traditional Medicare. So there's also not any prescription coverage in traditional Medicare. So what we suggest to people, and we send people to a Medicare person that we'll talk about here in a minute. What we suggest to people is that they get a Medicare supplement plan that would fill in and cover all of those gaps for you and make it so that there's certain Medicare supplement plans out there that can make it so that if something happens to you, basically all you're responsible for is a Part B deductible of like, I can't remember what it is right now, $240 or something like that, even if you had a major thing happen. So we suggest that people get a Medicare supplement policy. The Plan G is the plan that I was just talking about. There's a bunch of different ones. And you can go to any doctor that accepts Medicare patients with Medicare supplement policy too, which is great. There's other plans that we'll talk about here in a second that don't allow you to do that. And then you also need to sign up for a Medicare Part D. D is for drugs. That covers your prescriptions.
So I see ads on TV and get lots of mail about zero premium Medicare plans. What are those?
Those are Medicare Advantage plans. Those are a different option that you can take as opposed to a Medicare supplement that we just told you about. The Medicare Advantage plans, we typically steer people away from those. Usually they work a lot like a traditional healthcare plan, so they don't have the same benefits as regular Medicare Parts A and B. They have like their own deductibles, co-insurance, co-pays. Those change every single year. You have to shop around for a different plan every single year, and the network of doctors that you can go see can also change every single year. It's a plan that's all wrapped into one, and the prescriptions are wrapped into it too, I believe. Typically, for most people who can afford a Medicare supplement policy, that's going to be a better route for them than these Medicare Advantage plans. The Medicare Part D is also a thing that you need to sign up for every year, and something that you might get information on from a bunch of different plans. What's important about choosing your Medicare Part D plan is that you need to plug in your prescriptions to choose a plan and see what's covered, because the different plans change what drugs they cover and at what rate and all that stuff every year. So another quick note that I want to make is that you have an important timing window right when you turn 65 or right when you retire and go off of your work health insurance plan, whichever one of those things happens later. So basically, when you sign up for Medicare Part B, You have a window of opportunity where you can sign up for a Medicare supplement policy without having to go through any health underwriting.
Right.
So you want to sign up for it right away. Don't wait around and think, well, maybe I won't need it and I'll sign up later, because they'll make you go through health underwriting. And usually by the time you want to sign up, you got something going on with you. And then for the Medicare Part D, the prescription drug plan, you want to sign up for that right away as well, because for every month when you eventually need it, because even if you don't have any prescriptions now, probably at some time in retirement, you're going to need prescriptions and want a prescription drug plan. When you eventually need it, if you haven't had coverage, they'll penalize you for every month that you haven't had coverage, and they'll tack that on to your premium for the rest of your life. It's permanent. So both of those things are important and timely to do right away when you become eligible. The Medicare supplement and the Medicare Part D, sign up for those.
So regarding Medicare, Jesse and I are health insurance licensed. We have all kinds of licenses, and besides investments and stuff, but driver's licenses, fishing licenses.
Kind of a big deal.
But we're licensed to sell this health insurance, Medicare supplement insurance, but we choose not to, and we kind of turn that over to a friend of ours that we've worked with for several years. That's an expert, knows even more than Jesse does about Medicare.
Well, and it's
Medicare
complicated, so
Yeah.
he'll go in on
Yeah.
all of the details and the ins and outs of how everything works
Yeah.
with you, much more than this quick little.
Yeah. So
5
this guy's name's Dave. We'll connect you with Dave, and he'll take care of you and answer all your questions. By the way, we don't have any kind of a financial relationship with Dave. We just send our friends and customers to him because he takes good care of them. Like